My name is Edmund Charles. I'm a medical student from the University of Nottingham, and I'm here to present the validation of the Nottingham Clavicle score, which is a ACJ, Clavicle and SCJ patient-reported outcome measure. Now, the patient-reported outcome measure is a useful tool to be used in clinic. They're easy to fill out questionnaires completed by patients, and they've gained recent popularity for their ability to better reflect patient satisfaction following our interventions. However, there are currently no PROMs on the market for ACJ, Clavicle and SCJ injuries. Now, while the Oxford Shoulder Score is used routinely in clinic, the score itself does not have any weighting for sports or recreation. And similarly, the constant score is also used in clinic. However, this score only allocates 4 out of 100 points for recreation, and this weighting has neither been validated nor properly rationalised. This is why we designed the Nottingham Clavicle score. This is a 10-item PROM with a maximum score of 100 and a minimum score of 20. Which items 1 to 4 measure pain, so the pain that you usually have from the shoulder, the pain felt at night from the shoulder, the pain during activities of daily living, and most importantly is item 4, which measures pain during sports and recreation. And it's the inclusion of this question that makes the Nottingham Clavicle score more appropriate than the Oxford score for measuring injury in sporting and active people. Items 5 and 6 measure the ability to lift heavy objects and overhead strength, and item 7 measures cosmetic satisfaction. Now, evidence has shown that the main benefits to be had from operative treatment of a Rockwood grade 3 ACJ dislocation is the improved cosmetic satisfaction. So we believe this is a very useful tool in deciding whether a patient will receive conservative or operative treatment of their injury based on how they feel. Item 8 assesses movements and clicking in the shoulder, and items 9 and 10 assess tingling and numbness in the arm and neck, and heavy or dragging sensations in the arm. Now, these last 3 are commonly seen discomforts following these types of injury. This was a part prospective, part retrospective cohort study, which included 70 patients with clavicle, ACJ and SCJ conditions that required surgical intervention, and we reviewed the preoperative and 6-month postoperative evaluations of outcome with the Nottingham Clavicle score, and then compared these results with already established outcome measures: the Oxford Shoulder Score, the Constant Score, the Imatani Score, and the EQ5D generic health measure. We assessed reliability, reproducibility, validity, and sensitivity to change. And we saw a range of conditions over the study period, mainly comprising ACJ dislocations grade 3 to 5, clavicle fractures, and ACJ and SCJ osteoarthritis and pain. Our results, when we analysed the results we had, our reliability was excellent. Cronbach's alpha was 0.87, and after the removal of item 7, which measured cosmetic satisfaction, the alpha was improved to 0.9. Reproducibility was assessed by asking 50 patients to complete a second clavicle score 24 hours after the first, and of these 50 return scores, 49 scores actually showed a difference of less than 10 points, with the majority of scores ending it within 5 points of the first recorded score. Validity, our Wilcoxon test demonstrated significant correlations post-operatively between the Nottingham Clavicle score and all of our comparison scores. And when we measured sensitivity to change, the Nottingham Clavicle score had the largest effect size of all the scores tested in the project, with 91% of our patients with improved clavicle scores also reporting an improvement in their symptoms. So to conclude, this is the Nottingham Clavicle score, a new, unique and easy to use patient-reported outcome measure for the assessment of injuries to the clavicle, ACJ and SCJ. It's been shown to be reliable, reproducible, valid and sensitive to change over 6 months. And while we found the cosmetic item was slightly less reliable, it was considered an important determinant of patient satisfaction, and so it was not discarded from the score. And now studies involving larger numbers of younger sporting patients over a longer period of time will help to test the clavicle score further, with the ultimate aim of promoting its use in clinical setting. Thank you.